Welcome to Education and Healthcare in Cuba. I am your instructor, Jenny Desmond, the president of Viva Cuba, and this is part of a 7-part series of classes that I teach about Cuba. If you are a Viva Cuba tour participant, then you should have the notes where you can, an outline where you can take notes, and it includes a full bibliography. And if you're not, then for a small price, you can purchase access to those. But I hope you learned something new and perhaps surprising about the world-renowned education and healthcare of Cuba. So educational reforms in Castro's new Cuba in 1959 and beyond. So in 1953, before Castro came to power, only 44% of Cubans ages 6 to 14 were attending school. That tells you that less than half of all children in the country were attending any type of school. So in 1958, the year before Castro came to power, there were a mere 6,000 students at technical schools and 2,000 at universities. What's shocking is contrast that with the data from 10 years later, where there are 5 times as many students in technical schools and 20 times as many students at universities. This 40,000 students at universities is stunning and really a tribute to the success. So in 1961, Fidel Castro began closing all private schools, many of which were run by the Catholic Church. 250,000 educated Cubans, roughly 100,000 of them were teenagers, went out as part of the National Literacy Campaign to all remote areas of the island to live and to work with campesino families. This really started in April of 1961, which happens to be the same month that the Bay of Pigs attack happened. These literacy workers would assimilate into a rural setting, working during the day alongside the other Cubans, and then teaching people of all ages at night to learn to read and write. And one of the powers in this was that the ideology of the revolution and loyalty to Castro's new Cuba was expounded. And it created a literate population who were loyal to the government. There was no tolerance of criticism of socialism as a way of life. And if you do a quick search on YouTube, you'll find a link to Maestra, the film. And there's a trailer for it there, and it's really fascinating. A lot of it is in Spanish, but it's got subtitles. It's a 3-minute trailer, and it's worth watching. Unfortunately, I can't show it because it's copyright restricted. So in Cuba, there is a free education system. And so that means that there's an ample supply of trained volunteers to rural areas of Cuba. So some of the factors that influence the education system of Cuba is that it includes a comprehensive early childhood education and student health programs, making sure that kids are ready when they start school and that they are strong and healthy. There's a carefully structured competition that has a socialist bent, and so it is competition in classrooms that's all about enhancing the growth of the whole class rather than that of the individual. There are explicit strategies to reach rural students and students with special needs, and there are strategies that link school and work. So what happens is high schoolers during their breaks, the breaks are timed in coordination with the harvest, perhaps of the citrus or root vegetables. And so then students are sent out to live in dorms in the fields, and they would work helping harvest during their break. It's something that's died off over the last couple of decades, but was a very important part of the first 30 years of Cuba's education system. So the University of Cuba, or University of Havana, was established in 1727. And the Ministry of Higher Education manages the policy for both undergraduate and graduate programs. This includes content, methodology, teaching, and allocations of student placement as well. So students are placed. Currently, there are over 110,000 citizens enrolled in college. And each and every one of these will deliver their new learned skills for an equivalent number of years in rural communities for far lower incomes than national rates. So say you go to the National University, you get a 4-year degree, then it costs you no tuition, but then when you're done, you'll be sent out to a place in the country where they need somebody with your professional training, and then you'll serve 4 years there before being able to choose where you want to live and how you want to practice in your new profession. So it provides a lot of low-cost workers throughout the country. Some of the powers of this education system is that there's a proportional female representation at all levels, including in higher education. So women in Cuba have equal opportunity to education, as do the men. The education system has a strong scientific training basis, particularly in chemistry and medicine. There's consistent pedagogical quality across widely dispersed classrooms. And there's an equality of basic educational opportunities, even in impoverished areas, both in rural and urban parts of the country. Cuban doctors around the world. Medical school in Cuba is covered by the Cuban government for each student. It's around $10,000 to $15,000 a year. And the perspective is that these hundreds of thousands of doctors are urgently needed around the world. And so the goal is to increase those ranks as quickly as possible. So Cubans prize educating doctors, and then they send them around the world. Something interesting that happened in November of 2018 was that Brazil ended ties with Cuba, and a couple other Latin American countries have followed. So Brazil's far-right President Bolsonaro ended a 2013 agreement with Cuba, which traded doctors for cash between the two countries. Bolsonaro said that Cuban doctors were being used as slave labor because the Cuban government took 75% of their salaries and separated them from their families. Cubans, many of them, take pride in being able to serve abroad in this doctor exchange program. And part of it is because while the Cubans are abroad, then the Cuban government will put money away in a savings account that is inaccessible to the Cuban until they return back to their homeland. But it gives them access to more resources than they would have had staying in Cuba so that they can financially help their family. In Brazil, there were over 8,000 Cubans that were practicing in poor and remote areas of Brazil where Brazilian doctors did not want to work. So that is the downside, is Cubans are sent to a foreign country and they're sent to the areas with the highest need, and they're taking care of the poorest of the poor. In 2018, Time magazine estimates that this program of leasing healthcare professionals to foreign governments around the world brought in $11 billion a year, making it a bigger source of revenue than even tourism. So here's a fascinating PBS News special about doctors as part of Cuba's foreign policy strategy. Because not only does it bring in money for Cuba, it also creates goodwill and overrides what the world media says about the evils of Cuba and communism, and that people around the world were getting to know Cubans as their doctors and prizing Cuban doctors. So we're going to watch the first part of this NewsHour special, but you can find it on YouTube if you just do a quick search for this title, Debt-Free Doctors, part of Cuba's foreign policy strategy.
Medical diplomacy. Ray Suarez and our Global Health Unit wrap up their three-part series with this story.
A 28-year-old American, Pasha Jackson is in his second year of medical school. But his medical career actually started a year earlier when he had to begin a crash course in Spanish. Because Jackson is learning to be a doctor in Cuba, and his entire 6 years of medical education is being paid for by the Cuban government. He's one of about 10,000 students from 29 countries now enrolled in Havana's Latin American Medical School, including more than 100 Americans.
I've always had the interest in medicine. Medicine, biology, anything that has to deal with how things work, especially if you're talking about organisms. That was my deal.
The school offers full scholarships to foreign students, mostly from low-income families with good academic records. 6 years of medical education and room and board, and it's all free. How can one of the poorest countries in the Western Hemisphere give away something so precious to so many and expect nothing in return? The Latin American Medical School is the brainchild of Cuba's Fidel Castro. The school's aim is to create a pool of physicians for public service in disadvantaged rural and urban areas around the world. Dr. Maritza Gonzalez Bravo is one of the school's directors.
Our rationale, the training, the values that we have here are a way of continuing the revolutionary process, the eternal ideology of our leader, Fidel Castro, which is to always help out poor countries, not with what we have left over, but what we have.
The school is an outgrowth of what's become known as Cuba's medical diplomacy. When these students graduate,
they become health ambassadors, capable of taking home the principles of Cuban values and solidarity.
This place has unusual prerequisites for med school. The students must have high school diplomas, be under 25, and come from the poorest parts of their home countries.
This assures that they are committed to return to their communities so they can make change in their own villages and neighborhoods.
Pasha Jackson is from Oakland, California. A standout student and athlete, Jackson went to the University of Oklahoma on a football scholarship, even making it to the NFL. When an injury put his football career in doubt, he turned to medicine and to Cuba.
Receiving this gift from a country who already does not have a lot, there's no way that I'm going to return back to the United States and just take any job. You know, I want to be able to give myself to the very communities who are underserved and be able to serve them and provide these services for people who normally would not have such access.
Since it opened in 1999, the medical school has graduated more than 7,000 physicians from 45 countries. Cuba doesn't ask these students to practice here because the island already has more doctors per capita than any country in the world. Cuba's own medical professionals have become a big part of the Havana government's outreach to the world. Cuban doctors are rushed to natural disasters across the globe, like last year's devastating earthquake in Haiti, where Cuba dispatched more than 600 medical workers. Over the last 20 years, exporting Cuban doctors has become part of the country's foreign policy strategy. Many Cuban doctors will, at some point in their career, go on overseas missions, most to developing countries with severe doctor shortages.
You can see all the province here.
Right. Dr. Jorge Delgado of the Cuban Health Ministry spent almost a decade practicing in Africa and now directs overseas missions.
Trabajadores de la salud médicos, técnicos.
As of now, we have more than 350,000 healthcare personnel, doctors, technicians, nurses, and other specialists sent out to support 105 countries around the world.
Gail Reed is an American who lives in Cuba and edits the medical journal Medic.
It's a foreign policy to the extent that what can a small country do? You don't have foreign aid and big dollar sums to give, so what can you give? You have your human resources.
The medical missions have also been described as a way for Cuba to get around a negative worldview of its human rights record. Cuba's Ministry of Health describes the international medical aid as a natural outgrowth of Cuba's educated population and revolutionary vision.
Que nuestra principal riqueza.
Our main source of wealth is human resources. Everyone knows we are a poor country, but providing Cuban doctors to other countries grew out of the ideas of our commander-in-chief, Fidel Castro, who said we are paying our debt of humanity to our brother countries who support our revolutionary causes and who need our vast human resources.
One young Cuban doctor, Orislaria Morales, says she volunteered because she wanted to help families learn to prevent illness, something Cuban doctors are known for. She was sent to rural Bolivia.
We took with us our experiences, our preventive healthcare model. We took to places where conditions were pretty bad, but in turn we learned a lot from them.
It's a wonderful way of keeping very, very good diplomatic relations with very many countries.
Katrin Hansing is a Cuba scholar at the City University of New York and is writing a book about Cuba's medical diplomacy.
If you have ever been to any developing country where there are a lot of Cuban doctors or other professionals, Cuban doctors are loved, and by extension, Cuba is loved in those countries.
Cuba's doctor programs have also become a boon to the country's faltering economy. Money is flowing in from countries with growing economies but less educated workforces, giving Cuba and the doctors precious hard currency.
So again, you can find that full video and more on YouTube by just doing a quick search of debt-free doctors, part of Cuba's foreign policy strategy. Healthcare in Cuba. People often ask me, does Cuba have good healthcare? My answer really is that it depends on your perspective of what defines good in regards to healthcare. So here's some data from the World Health Organization. Total population in 2016 was 11.4 million in Cuba and 322 million in the US. So it gives you a perspective on the size of population we're dealing with in difference. But the life expectancy at birth in 2016 for men in Cuba is 77, and in the US it's 76. So a little bit shorter for men, and the same for women. The probability of dying has a larger difference here. So for men between the ages of 15 and 60, in Cuba it's 116 men, and in the US it's much greater at 142 men per 1,000. And the same for the women. It's a smaller number of women have a probability of dying before the age of 60 in Cuba than they do in the US. Another contrast that's interesting is the total expenditure on health per capita. In Cuba, it is only 2,400 versus in the US, it's 9,400. And the total expenditure on health as a percent of the GDP is 11% in Cuba, and it's a much larger percent in the US of our GDP at 17. So how does this work? Prevention and house calls are very important elements of Cuban medical. So thankfully, Cuba's high adult literacy rate makes it easier for doctors to teach their patients how to engage in their own health and for preventative health care to be taught to children in school. Family physicians often live near or in the population they're assigned to serve. So your family doctor could easily live down the street. They're very accessible. Doctors proactively contact their patients. They make house calls. They make sure their patients are receiving vaccines and services such as blood pressure checks. And family physicians typically spend half a day a week accompanying their patients when they are referred to specialists so that the family physician can learn from the specialist. Cuba has many more primary care doctors than specialists. They have about 70% of their doctors are primary care doctors, whereas in the United States, only about 30% of our doctors are primary care doctors. Alternative medicine is an important element of Cuba's healthcare. It's integrated into all levels, from clinics to hospitals, partly out of necessity because of a lack of resources. So not a lot of technology is available, but also because it is a routine part of their healthcare, and hospitals routinely offer acupuncture. So do you remember the Zika virus crisis of 2016? Well, in Cuba, they reported only 13 cases of Zika at the same time that Puerto Rico was recovering over 1,100, reporting over 1,100 cases. And if you'll remember at that time, in Puerto Rico and even in the southeastern US, the media was saying, just don't get pregnant this year because we can't control the Zika outbreak. I've read further studies that said that perhaps Cuba, by the end of the Zika crisis, had over 800 cases, but they weren't all reported. One of the reasons that Zika wasn't as much of a crisis in Cuba as in other similar areas was because of fumigation. So the Cuban government recognizes that by eliminating the Aedes aegypti mosquitoes that carry viruses such as Zika, dengue, they can control these viruses from breaking out. And so it's very common when you're, particularly in Havana, when you're driving around, to see men walking around with these fumigation machines. And what they do is they knock on your door and they say, we're here to fumigate. You get 10 minutes to get your things together, and then you leave for the day. They do their fumigation, and we often have Cubans say, oh, I'd love for you to come over today, but they fumigated, so we won't be back at our house until this evening. You never have this problem with your bed and breakfast, though, so do not worry about that. It will be interesting to see in the decades to come if there's a crisis of cancer or other diseases from these young men who were working these fumigation machines. So there are many advances in Cuba that the US hopes to learn from. And when Obama loosened the embargo in 2015, he made the ability for US researchers to study this a little more doable. So Cuba touts cures and remedies for diseases that we have in the US, yet we don't have those cures yet. One of them is addressing diabetic foot ulcers. So in Cuba, they developed a treatment called Herberprot P, and it's touted in 16 countries where it is registered, but it was developed in Cuba as a one-of-a-kind wound treatment that has proven benefits for avoiding amputations. In the United States alone, we have over 73,000 lower limb amputations a year performed on diabetic patients. So this is truly a crisis that we need to address in our country. Lung cancer treatment is another crisis that Cuba has come up with remedies for. So the Roswell Park Cancer Institute finally has been able to start doing research in partnership with Cuban researchers about this vaccine called Simivax. We refer to it as a vaccine, but actually what it does is it slows the growth of the lung cancer. In the US, more than 50% of patients die within a year of being diagnosed with lung cancer, making lung cancer the #1 cancer killer in the US. It kills more people than colon, prostate, and breast cancer combined, and it's very difficult to identify early. So most often it's discovered when it's at an advanced stage. So what happens with the Simovax vaccine is that patients are given monthly injections, and one report indicates that in a group of cancer patients over 60 years old, their mean survival increased from 7.5 months to 18.5 months in patients treated with the vaccine. So the third big advancement has been the elimination of mother-to-child HIV and syphilis. And in June of 2015, that was when the World Health Organization declared that Cuba is the first country in the world to eliminate this transmission. Castro's government, more babies. So the birth rate in Cuba is beginning to be a crisis because it is so low, and it is 1.7 in 2002, below the regional average of 2.3 children per woman. So what they're finding is their population is aging with not enough young people to replace them and to maintain the economy. Castro's government is excellent at prenatal baby care. The average number of prenatal medical visits is 24. Remember, this is only a 40-week gestational period. In the US, for a healthy pregnancy, I would guess it's about 8 to 10 prenatal visits. So included with prenatal visits, there is an available maternity home in every city in Cuba, which provides medical assistance and nutritionally balanced, calorically dense meals to women who have high risk pregnancies. The Cuban health system provides all women of childbearing age extra iron, vitamin C, folic acid, and vitamin A supplements at no cost in order to prevent the risk of disability, babies born with disabilities. So why are there fewer babies in Cuba? Well, one part is certainly that women are more well educated, so they know how to prevent unwanted pregnancies. Another piece is that their local doctor, healthcare provider, lives nearby, and birth control is provided free and easily accessible for all Cubans. But another reason is because many Cubans don't want to have many babies because of the poverty. So on $20 a month, there's just little money to pay for a third person. So Cubans are often making $20 to $45 a month, and it's tough to get by for 2, let alone 3. There are scant job opportunities, a shortage of available goods. So even if you have a baby, where are you going to find diapers, baby food, formula, lack of sufficient housing. In many places, multiple generations live together. And so adding a baby into the mix makes it even more difficult. And then women are choosing birth control. So abortion is legal, free, and Cuba has some of the highest rates in the world. By the numbers, the country exhibits a rate of nearly 30 abortions for every 1,000 women of childbearing age, whereas in the United States, it's about 17 abortions for every 1,000 women. And in Russia, they are the country in the world with the only country in the world with an even higher abortion rate. So that ends this session of Curious About Cuba. I hope that you learned something new about education and healthcare in Cuba. Be sure to like and to subscribe and to watch the other class sessions for education about Cuba before you go to Cuba. Thank you.